All right, we will now begin the session. So good morning, everyone. Welcome to this much anticipated event. We thank you for joining us on this lovely Saturday morning. This event has been brought to you by SCAGO, the Sickle Cell Awareness Group of Ontario, in collaboration with Black Health Alliance and the Black Resiliency Cluster. And this morning, I am Dapo, your moderator. I'm joined by my colleague, Tolu. We're both SCAGO COVID-19 ambassadors. And our panelists today are Dr. Modupe Tunde-Byass and Dr. Melanie Kirby-Allen. Before we begin introductions, I would just like to read the land acknowledgement. We acknowledge the land we are meeting on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, and the Haudenosaunee and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. So it's my pleasure today to introduce to you Dr. Modupe Tunde-Byass, who will be the one giving the presentation and should be supported by Dr. Melanie Kirby-Allen. So Dr. Tunde-Byass has been active staff of Northwick General Hospital since 2004. She's held major administrative positions as a residency site coordinator, interim chief of OGBYN at Northwick General Hospital. She's involved in many key quality initiatives at the local and provincial level. She was the co-chair of the quality standard in increasing access to vaginal birth after cesarean section and an expert panel member for early pregnancy complications and loss. She's received numerous teachings and innovation awards, and she is heavily involved in medical education and has presented some of her research at international conferences and has publications in peer-reviewed journals. Dr. Tunde-Byass is also the president of the Black Physicians of Canada, and she's involved with a lot of equity, diversity, and inclusivity with particular focus on anti-Black racism. Dr. Tunde-Byass is also the co-founder of the Women's Health Education Made Simple, WHEMS, an initiative that promotes health literacy through online educational resources. So we thank you so much for being here, Dr. Tunde-Byass, lending us your expertise and knowledge. And Dr. Kirby-Allen, a lot of you might be familiar with. She's on the advisory board of directors of the Sickle Cell Awareness Group of Ontario and has given numerous talks and presentations. She's an academic clinician in the Division of Hematology and Oncology at SickKids. She's also an associate professor of pediatrics at the University of Toronto, and she's a co-director of the hemoglobinopathy program in the Division of Hematology and Oncology at SickKids. And she has served many years on the advisory board at SCAGO, and she provides medical oversight to the organization, as well as being the chair of the Quality of Life Committee and a member of the research team. She's definitely a champion within the sickle cell community, and we thank her for always being available. So thank you, Dr. Tunde-Byass and Dr. Melanie Kirby-Allen. And Dr. Tunde-Byass, you may begin your presentation.
Thank you so much for such a wonderful introduction, and I'm so pleased to be here today. I want to first acknowledge the work that SCAGO has been doing. And SCAGO, as you know, started as Seed of Life Philanthropy organization way back in 2005. And it's become one of the leading charitable organizations supporting sickle cell disease. I personally want to thank Larry and all the numerous volunteers and families that have brought sickle cell disease to the forefront. And I have family members and friends who had lived through this disease. And without your work, it would have been impossible for people to know this. Today, I want to disclose that I have no affiliation to any pharmaceutical or medical device, and I do not intend to make therapeutic recommendations for medications that are off-label. I have not received any financial support and any payment from any organizations. Before I begin, it's important that you, the participant, at the end of my talk, you should be able to discuss the short and long-term effects of SARS-CoV-2 virus infection, discuss the common myth associated with COVID-19 vaccine, understand how this vaccine works, and some of the concerns that has been raised about this vaccine in relation to reproductive health. We should look at the data in pregnancy, and I also want to talk about vaccine hesitancy. I would like to acknowledge that I am in the traditional territories and also want to acknowledge the historical oppression of lands, culture, and original people of what we now know as Canada. And I believe in contributing to the healing, decolonizing journey we all share together. I'm on the traditional territories of the Wendat, the Haudenosaunee, and the Anishinaabe peoples, whose presence here continues to this day. I would like to also acknowledge that this is the treaty lands of the Mississaugas of the Credit, and I thank them and other Indigenous people for sharing this land with us. I'm also grateful to Indigenous scholars, healthcare providers, and communities for giving voice and meanings to terms like intergenerational trauma, cultural safety, and racism as social determinants of health. Land acknowledgements are just one small part of dismantling colonial worldviews. So please take a moment wherever you are to think of other ways you can enact decolonization. As a Black person too, I wish to acknowledge my ancestry, a deep and profoundly relevant history of Black peoples across the diaspora, a history, lineage, and inheritance that predates this country, chattel slavery and colonialism that begins with Africa, an ancestry that recognizes the struggle and survival while honoring our own narrative of pursuing self-determination. Today, I stand valued, grateful, and proud to be Black. So let's start with COVID-19. So this coronavirus disease is a novel strain of virus, which means it's new and is caused by SARS-CoV-2. It was discovered in 2019, hence the name COVID-19. The WHO, however, declared a pandemic on March 11, 2020. Friends and family, can we believe that we've been in the pandemic for 18 months? As of a month ago, 213 million people have contracted this virus, of which 4.5 million deaths have occurred. Typically, this virus seems to like the lungs. However, the whole body can be affected and it can have lasting damage. I want to acknowledge that I stole this picture online. However, it demonstrates what I want to talk about the effects of SARS-CoV-2 on the whole body, both in the long term and also in the long term. Let's start from the brain. Acutely, when you get this infection, you can have headache, dizziness, strokes, seizures. But on the long term, it's been shown that there could be risk of Alzheimer's and Parkinson's disease in the future. The eyes could be red. You can have watery eyes, conjunctivitis. On the long term, maybe retinal damage. The nose and the mouth, loss of smell, taste. And this could last for weeks, months, and years before you get your sense of taste and smell back. The lung is perhaps the most prevalent organ that is affected, with cough, pneumonia, respiratory failure. And on the long term, people can develop lung scarring, which may require lung organ transplant. The liver, of course, can be damaged, and on the long term, requiring liver transplant. The heart, we're talking about dysfunction, heart attack, myocarditis, and also lung injury in the future, heart injury in the future. Gastrointestinal tract means diarrhea, nausea, vomiting. You can have inflamed pancreas, disturbed metabolism, kidney injury, renal failure, and also the testicles. The testicles can also be affected. You can have inflammation of the testicles, and that itself can lead to infertility in the future. So this disease affects everywhere in your body. That is why it is so important that we need to get a hang of it. Let's talk about the way it can cause infertility in men. I was quite intrigued to read about this, that men have been reported to be more vulnerable to COVID-19 infection. This is because there's a receptor on the testicles, the cells of the testicles, called the AC2 receptor, which aids the entrance of SARS-CoV-2 into the testicles, and it causes inflammation. It disrupts the function of the testicles, and the cells that make testosterone are also affected, such that there's less ability to make testosterone, and it also disrupts sperm function and leads to abnormal formation of the sperm. Furthermore, it can disrupt the DNA within the sperm. So a COVID-19 infection can cause infertility in men, and this infection is very nasty. Let's talk about the myths around COVID-19. If you go on social media, you would see this. One of the myths is that this research is new. Well, the technology is new, but I can assure you that even though we think the research is new, this is an old technology that has become new. This technology has been around for decades. It's been used for gene therapy and also to treat cancer. People think if you get COVID-19, you're more likely, if you get the vaccine, you're more likely to come down with the virus. This is not true. The vaccine does not contain live or killed virus. It is a protein. Have a microchip to track everyone's movements? I don't think so. It does not contain microchip. People also on the internet say that there's some electromagnetic field around it. It does not contain metals. And if we are able to use cell phones without worry, we shouldn't have to worry about this vaccine. It does not alter our DNA or make us become a zombie. It is an mRNA vaccine which disappears once it's into the body. And lastly, people think, well, it takes years and decades to develop vaccine. How come this was developed too fast? Once you have a pandemic, you've lost the control. So researchers in this situation came together from all over the countries very quickly. They cut out the red tapes. They put a lot of money into the research so that they can come up with an effective vaccine, which is needed in the pandemic. So other people think that, well, I'm going to wait until there's more research before I get this vaccine. There's enough research available now, both in people who are pregnant and non-pregnant people, and we have robust evidence to show that this vaccine is now safe. How does this work? Like I said, it's an mRNA vaccine. It does not contain any virus. There's no additives, there's no dye. So if you have allergies, you can still take this vaccine. So once you get the vaccine injected into your body, it gives the cells in your body instructions to make proteins. So once the proteins are made, then the body then says to itself, wow, what do I do? Then the body produces the spike proteins similar to the ones that you see in the virus. The mRNA protein itself then becomes destroyed once these proteins are made. It does not go into your DNA. So the body now recognizes that there's this vaccine and it produces immune response, which are fighter cells, and we call them antibodies. It activates our immune response, these T cells, to destroy the infected cells. So when you now encounter this virus, the spike protein helps our body that makes these antibodies will then fight this virus even before you become sick. That is the way the vaccine works. And it, like I said, it does not affect your DNA. It's an mRNA vaccine. So let's talk about COVID-19 and infertility. I get asked all this all the time. So what do we know? What is the research? How did this come into the social media? Like, everything on the social media goes very fast. This whole issue started with two physicians, one a German physician, and the other one used to be the chief science officer in Pfizer, and they posted on the social media that the vaccine affects infertility. As an OBGYN practicing in a busy unit with a flair for high-risk pregnancy, there is no correlation between this vaccine and infertility. What it is that the spike protein in the vaccine shares a similarity with a protein in the placenta called syncytin-1. Syncytin is also seen in the sperm of men. So let's look at it. These two are different. The body cannot confuse the spike protein vaccine with the syncytin in the placenta. It's like saying the lion and the elephant, because they live in the game reserve, they are the same animals. We know that is not true. We also know that people who have contracted COVID-19 infection, they have developed antibodies after their infection. We have not reported cases of infertility in these individuals. So there is really no correlation between the vaccine and the COVID and infertility, to be clear. So if you look at what exactly is this graph, this is the graph of infants born during COVID-19 pandemic in Ontario. The gray line represents the average number of babies born between 2018 and 2019 in Ontario. The darker line represents the babies that were born in 2020. Remember, the pandemic was declared in March 2020. And you could see that by the end, so anyone who got pregnant before it was declared, up until April, you could see that the deliveries actually fell. The orange line, however, is the delivery in 2021. The delivery plummeted in January and February. That means those people who were avoided getting pregnant around April, May, when the pandemic had been declared. But after that, you could see that the rate of growth has increased because people became more confident in trying to get pregnant. We also know that in my practice, I have delivered 2 babies now within the pandemic, and people have become confident in getting pregnant in the pandemic. And March 2021 became the time that the government of Ontario made pregnant women a priority in receiving the vaccine. We will talk about that soon. So let's look at the data here. The number of pregnant mothers that contracted COVID-19 virus, almost 2,200. 9% of them were hospitalized. And of those 9%, almost 20% were admitted to the ICU. And some of them required ventilation and intubation. 1,651 pregnancy had live births, which accounts for 75% of those who contracted COVID-19 infection. 12% were delivered prematurely, which means early delivery of these mothers if they contracted COVID-19. And 16% of those babies were admitted to ICU. And remember, it was not in March 2021 that pregnant individuals became a priority group to receive the vaccine. So let's summarize it. How is the vaccine and pregnancy and breastfeeding? What are we saying to people? In the first two phases of the development of the vaccine, pregnant and breastfeeding individuals were excluded, which was a huge mistake. We have learned from this mistake. Vaccines administration in pregnancy and during breastfeeding is never a new concept to us because we give diphtheria, pertussis during pregnancy. So we now know that people who contract this disease have a high risk of developing severe illness, leading to early delivery of their babies. So COVID-19 infection can be serious in pregnancy. It can lead to hospitalization, intubation, ventilation in pregnant people. And there's now growing evidence about the safety of this vaccine in pregnancy and breastfeeding. The vaccine can be received anytime during the pregnancy, and it is safe. You can also get the vaccine before you get pregnant. The vaccine protects pregnant people against severe illness, and also the risk of hospitalization is less. We are now finding out that when you get the vaccine in pregnancy, you build up antibodies that might protect the baby against developing COVID-19 infection after birth. We also have new studies that have now included pregnant and breastfeeding women, and these studies are showing that vaccine is safe and beneficial to the babies as well. We know that there is no difference between vaccinated and unvaccinated individuals in the rate of vaccinated and unvaccinated control, in the rate of hospital admission, miscarriages, small babies, which shows that the vaccine is also safe. And this has been supported by different organizations in the world. We have NACI and CDC, which are regulatory bodies, and these watchdogs continue to monitor any kind of side effects that emanciate from receiving COVID-19 vaccine. So it's a good thing to know that there are people watching out, and if you have any side effects, there are places where you can report the adverse side effects so that we can all learn from the effects of the vaccine. I've been asked to talk about fibroids. So we know that fibroids is a benign growth in the wall of the uterus. It is the commonest benign tumor that is seen in women. In fact, 70% of women would develop fibroids by the age of 50. It is more common in racialized women. There could be one or two or multiple. Fibroids typically cause heavy bleeding, miscarriage, depending on where it is located. It could also cause pressure symptoms, which means going to the washroom a lot, having constipation. This depends on the location of the fibroids. Most people do not have any symptoms, and the fibroid is detected maybe during routine examination or after an ultrasound. The management of fibroids could be medical or surgical. And if you have no symptoms, you don't need to treat the fibroids. It's important to speak to your healthcare provider to know whether to be referred to a specialist or not. One last thing, there's no effect of the vaccine on development or worsening of the symptoms of fibroids. Additionally, endometriosis. What exactly is endometriosis? It's the presence of tissue that you see in the uterus, and this tissue is found outside of the uterus. It could be anywhere in your body. This tissue can be in the lungs, it could be in your scalp, it could be in the vagina. but the commonest area is in the ovary at the back of the uterus, around the bladder, and also the rectum. 1 in 10 women are affected by this. It typically causes significant pain, heavy periods, painful sex, painful intercourse as well. When you go to the washroom, you can have pain during micturition when you're voiding and also when you're opening your bowel. This takes a while to diagnose in a lot of women because you have to have that high index of suspicion to be able to diagnose it. The treatment varies depending on the symptoms, whether you need medication first or you need an operation. It can also cause infertility. Lastly, it has no effect on your vaccine status, and COVID-19 vaccine is safe even when you have endometriosis. I also want to talk about vaccine hesitancy, which according to the WHO is a delay or refusal in getting the vaccine despite its wide availability. And there are so many reasons why people are hesitant. And it's important that we as healthcare providers do not judge people. We have to listen and ask questions. Why are you hesitant? People have a mistrust for the government and also the healthcare system. There could be conflicting reports about the vaccine itself, which leads to confusion about the safety of this vaccine. And the reason for the confusion is that very few of us have lived through a pandemic before. The last pandemic was almost 100 years ago, which was the Spanish flu. And the mistrust of the drug companies is another reason why people do not want to trust getting the vaccination. How about historical background, especially if you're Black or Indigenous? Do we forget the trial the syphilis trial in Tuskegee, Alabama, or the forceful sterilization of enslaved women without consent or anesthesia, or the sterilization of Indigenous women? So people are disillusioned with the system, which appears not to care, and where their inequity exists in everything. However, as I stand before you today, let us make no mistake. Once we have a pandemic, the vaccine is needed to halt the spread of the infection. And also, it's a way for each and every one of us to protect ourselves, our loved ones, and also people around us. We want to hear from you. So we are conducting a study and we are looking for participants. And if you identify as Black or someone from the South Asian community and you're between the age of 18 to 65 and you live in the GTA and you have not received the COVID-19 vaccine, we want to find out what we can do and also whether we can share some resources with you. We're not here to judge you. And you can get the information from Women's Health Canada at gmail.com. Women's Health Canada at gmail.com. You can send us an email and we will take it from there. So to conclude, COVID-19 infection can cause a mild to severe infection, and the infection can be life-threatening and can have a long-lasting effect, which can be debilitating. And I have seen pregnant women who have been intubated and needing oxygen after they've been discharged home. Vaccines are essential in the pandemic, and it reduces the risk of hospitalization severe complications and death. It is safe. Initially, it was approved for emergency use, but now it's been approved for routine use. The side effects are tolerable, and that includes swelling around the injection site. Sometimes you can have aches and pain, but severe side effects are rare. And those side effects that would make you not to get the vaccine if you have allergic reactions to it, or you have allergic reaction to some of the substances or the ingredients that are being part of the makeup of the vaccine. Whether you have allergies to dye or eggs, you are still okay to get this vaccine. The benefits outweighs any of this risk. Lastly, it does not cause infertility or damage to the reproductive system. I want to encourage you today, if you have not received the vaccine, to book for one and do receive it. I am the president of Black Physicians of Canada, and we can be contacted, and we're on most of the social media platforms. I'm also the co-founder of Women's Health Education Made Simple, and we provide health education to women online. And we started this initiative during the pandemic to help people access evidence-based information about their reproductive health. And we are on Instagram and all the social media platforms as well. I'd like to thank the organizers of this event. I'd like to thank the volunteers and also the families of people who live with sickle cell disease. Thank you so much for giving me the opportunity to come and talk today, and I'll be happy to take questions. Thank you so much. You can stop sharing, right?
Yes, you can stop sharing.
Okay.
Thank you very much, Dr. Tunde-Byass, for that informative and enlightening presentation. And hopefully it's covered a lot of topics and questions most of you attendees have had. But now we will open it up to the Q&A session. So just a few housekeeping rules. Some people have emailed us some questions, and some of you have asked questions within the Zoom chat below. So we will alternate between the questions that were emailed to us and the questions that have been asked in the Zoom session. We just kindly ask to bear with us because there's quite a few questions to go through, and we'll do our best to answer them all. The information from Dr. Tunde-Byass's slides will be shared with all of you after the session. And if you have any questions or follow-up inquiries, you can always reach us at covid19@sicklecellanemia.ca. I will also share that information in the chat and in a follow-up email. Lastly, we have a poll at the end of this session, and we kindly ask that you fill it out and give us your feedback. So now to begin the Q&A session, I will start off with a question that was emailed to me. So Dr. Tunde-Byass, this individual is 40 years old, and she has had regular periods every month for the last five years. She has been on birth control for the last 20 years. After her second dose of the Pfizer vaccine in May, her next period was 21 days late. And she's never been late a week, yet alone 21 days. So she's wondering, is this a common side effect? Will her cycle go back to normal? And has her fertility been affected?
Yes, thank you so much for that wonderful question. And I first of all want to thank anyone who has had those kind of side effects, that they actually been able to bring those things up. And in my practice, I have seen individuals who have had slight changes in their periods. Either it's been delayed, either it's slightly heavier. And even people who, one person who has stopped having a period had one episode of the period. What's important is that when you have a difference in what is outside of your normality, you can speak to your healthcare provider. You may need, to be examined. You may need ultrasound and also further assessment. But by and large, this will have no correlation to your fertility in the future and also in the present. So this side effect, I have had it in my office, and we have investigated the women and they're back to normal.
Excellent. Thank you for that answer. So my co-moderator Tolu will be taking care of the questions within the Zoom. So Tolu.
Okay, so we do have quite a few typed in questions with regards to periods and menstrual cycles as well. But since that question has been so eloquently answered, I have another one from an anonymous attendee who said, should people with sickle cell trait for both parents be having children? Is there a 50% chance that your child will have sickle cell disease?
So is that for me or Dr. Kirby? I can take that.
Dr. Kirby, is that okay for you to answer?
Thank you. So if both parents are carriers, there's a 1 in 4 or 25% chance for every pregnancy of having a child who inherited both genes from each parent. So 25% chance every pregnancy. If you have a child who already has sickle cell disease, the next pregnancy is the same risk, 1 in 4 or 25% chance. Yes.
Thank you.
Excellent. All right, we will ask the next question. So this individual is 26 years old and she has polycystic ovarian syndrome. It hasn't developed into anything serious, but she has small cysts in her ovaries. She's not on any medications and she's been able to balance her hormones with diet and lifestyle changes, but she's scared that the vaccine will make it worse because she's heard of some cases where it has become worse, but she does not know if this is factual or not. So she wants to be healthy and able to have children in the near future. So her question is, can the vaccine make polycystic ovarian syndrome worse? And will her cycle and hormone balance be disturbed?
So thank you so much for that question. Polycystic ovary syndrome typically causes irregular cycle, acne, too much hair on the body, and sometimes infertility. That is polycystic ovary itself. This individual has managed this very well with lifestyle changes and also exercises. That is the first thing, and that's why the periods are regular. If your periods are regular, you have no acne or excessive hair on your body, and you're not wanting to get pregnant now, there is really no indication to treat the ultrasound, because the ultrasound shows this, but you don't have any overt signs or symptoms of the polycystic ovaries. So that's one. If and when you want to get pregnant, sometimes there could be a delay and you may need more investigation and also find a way to make the ovaries to ovulate so that you can have eggs and then be able to have children. The vaccine, to go back to that again, has nothing to do with PCOS. This is totally different. People who have regular cycles, if you get the vaccine, from what I'm seeing in my practice, some people may have a slight change in their period, maybe the 1 month or 2 months, and then goes back to normal. But there's no long-term side effects that we're seeing now. And so is also there's no long-term risk of infertility. But if you have a medical condition like PCOS that is not well controlled, then that could cause infertility rather than the vaccine.
Excellent. Thank you for that thorough answer.
Okay, and a question from the chat is, can you discuss a bit about research and the vaccine for children under 12 years of age? What are the concerns with vaccinating them? Dr. Kirby-Alley?
At this point, the research is ongoing, and we wait to hear when we wait to hear the outcome of the research. And from my knowledge, what I've heard recently is that the FDA is looking at some of these studies from age younger than 12, and we wait to hear that information. But from what I've heard, I haven't heard any big negative consequences of those kids in the study, but I haven't been given the opportunity to review the study in detail.
All right, thank you. All right, so next question. So this is also for you, Dr. Kirby-Allen. This individual is wondering if you could share any stats on the number of individuals with sickle cell to get COVID, their struggles, stats underneath that, or anything particularly relating to sickle cell disease and COVID and the COVID-19 disease and the long-term side effects for individuals with sickle cell disease. Yeah.
I work at the kids in pediatrics, and we have seen many children who've had COVID-19, a few with sickle cell disease. Some have required admission to hospital, and we have had no deaths, but we've had children. Many children have managed at home with viral type symptoms, but not requiring hospitalization. In the adult world, I think it's across the board. And looking at the US reports also, we've had very sick sickle cell patients with COVID, and then also the whole spectrum, like it is in the general population. Some people get infected and don't seem to get very sick. Some get sick, requiring hospitalizations, and some require ICU treatment. Those that have been vaccinated have done better across the board.
Excellent, thank you. All right, next question. So most of the questions were surrounded around irregular periods, so that's been covered. So I will read some other questions.
I do have another one though.
Okay.
So we have a question with regards to, would the vaccine make symptoms of fibroids or endometriosis worse? Has there not been any reports of changing menstrual cycles and heavier flows, which we have addressed, but someone wants to know if there's any correlation between fibroids and endometriosis and the vaccine. Dr. Kirby-Allen or Dr. Tunde-Byass?
Yes, thank you so much. So from my presentation, from what I have seen, I have not seen any correlation between a worsening fibroid or endometriosis. We still have to treat this condition either medically or surgically, or sometimes if there are no symptoms, we don't need to treat at all. So having said that, we are looking at vaccines in the past, in other ways, the tetanus, the diphtheria, there's really no correlation with those conditions and vaccination.
Thank you very much.
So one question, back again to the period. So Nathaniel just asked, what exactly causes the changes in women's periods, and what makes it irregular when they receive the COVID-19 vaccine?
So that's going to be a hard one to tell, how does this happen? Okay, nobody knows, because at the onset, people just came, not very many people that I have seen, but people came, well, I have noticed my period is heavier. We have to believe it. I have to investigate it. The one person that I had whose period had stopped and then had a period after 1 year, I had to forget about the vaccine as being responsible. I have to look at that individual as needing, investigation as if they did not receive the vaccine. So I don't have the pathophysiology of how this happens, but by and large, if there are things that we think are not normal, we have to address it in any way we would address it even without the vaccination.
Can I add one thought is vaccines create an immune response by the body. And if this is something that's being seen by several people are reporting this, it is probably related to an immune response from the body that changes changes the frequency of the period or the delays the period. But it seems like from what Dr. Tunde had said, it's a transient effect as your immune system gets back to baseline after responding to the vaccine.
Excellent. Thank you for
Thank
that
you.
addition.
I have
So-
a question for Dr. Kirby, since you're expert in hematology oncology. When you have sickle cell trait / sickle cell disease, does it make it more of a risk to have the baby, specifically if you do not receive the vaccine?
I think Dr. Tunde could answer that one.
So sickle cell trait, no effect on getting pregnant. You can get pregnant with sickle cell trait. Regarding vaccine, the vaccine is just for the effect on everyone. So if you're pregnant and you contract COVID-19, especially in the third trimester, the disease is actually worsened. And there's the risk of hospitalization, intubation, needing ventilation, and being delivered early. But the sickle cell trait itself, you can get pregnant. There's no correlation with infertility on that.
Dr. Tunde, can I ask, do you think that the reason why pregnant women, especially in the advanced stage of pregnancy, get worse COVID, it's a physical thing? The tummy is quite enlarged so that the lungs can't expand when the lungs are infected. Do you think that could play a role in patients being worse in the third trimester?
So I think with pregnancy, it's the physiological adaptation of pregnancy. Your heart rate, your respiratory rate, your lung capacity, like you said, the pregnancy also springs your diaphragm and all that. So all those things are much more heightened in the third trimester. And of course, the COVID-19 seems to like juicy lungs, right? So that's why the lungs is probably one of the heavily affected organ. So those physiological adaptations of pregnancy are more in the third trimester, and that is why one of the reasons why the effect is worse compared to the first or second trimester. But I have seen people get the infection in all the trimester of the pregnancy.
Excellent. Thank you for those answers. So I'm going to summarize some questions overlap and have a certain theme. So I'm just going to ask this question. It's more broadly in regards to the COVID-19 vaccine in general, rather than anything specific. So these questions are surrounding around individual citizens being indirectly or directly forced to take the vaccine and mandated to have it to socialize in public settings. They're talking about free will and, choose to get vaccinated or lose your employment or be isolated. So could you just provide your thoughts on, vaccination as a whole and why, governments are mandating it?
Yeah, I think that's a tough one, right? So, but I'm going to try to, to answer that. I think when you have a pandemic, we know that it affects everybody. It affects our health, our general well-being. It affects our children, our colleagues, our parents, people in the long-term care. Once there's a pandemic, we need something to halt it. And that's where the vaccination comes into play. We all love what we do. We all have a different way of how we would want the vaccination or not. And I think for most people, it's not that they don't want to take the vaccine, they still want time. They want someone to listen. They want to ask questions. And that's why we're having town halls, we're having webinars, we're having individual one-on-one to speak to people so that people have the ability to air their concerns and also to understand why we need a herd immunity to be able to protect the remaining cohort of the population that have not received the vaccine. So when we have majority of people who have received the vaccine, then the whole population is more or less protected. We need to think about our children. We need to think about, hospitals' capacity. We need to think about just not the COVID infection itself. How has it affected common individuals? I have people on the waiting list now for 18 months who cannot get their surgery done. They have heavy period. They have huge fibroids. They want to get pregnant. We cannot take them for the surgery. There's an individual who had a heart attack. They cannot access care because our beds are filled with people who have COVID-19 infection, who we also have to look after. I work in a hospital. I have to be vaccinated so that I can effectively care for people. So that is where all this is coming from. How do we best protect ourselves, our loved ones, and be the same citizens with the same goal? And I think that's what we all need to focus on.
If I could just add, that was excellent. If I could just add that people, when COVID-19 pandemic started, most of the people who got sick were in the elderly and people with immune conditions and other chronic conditions. But we also see very young, healthy people, and we hear, well, I'm young, I exercise, eat right, I don't drink, and why should I get a vaccine? If very young, healthy people also are getting unvaccinated, are getting sick, and their immune response is super good. And some of those are getting extremely sick and ending up in ICU, requiring intubation and being on ECMO machines. And so COVID does not discriminate. And across the board, even if you're young and healthy, we also see in little children, there's a COVID complication we see in healthy young children, which comes on shortly after having COVID. Some of them become COVID negative and still get sick. So don't think that you have to be an elderly person or a sick person or somebody with sickle cell to get COVID. Anybody can get COVID and can get very sick, even very healthy, young, strapping 30-year-old men.
Thank you. And I have a few new questions that have come up. So what are the implications of receiving the vaccine in breastfeeding mothers? Would it impact the production of breast milk? If the hormones are affected, would this not, affect breast milk production?
So breast milk and COVID-19 vaccine is safe. That's number one. What we're seeing now and from research is that the antibodies, it's passed on to the baby, which even makes it a need to get it. And thinking about hormones, it does not, as far as we know, it does not affect your hormones. So you can still breastfeed and still get the vaccine. What's also important is that when you have people come around, we have friends, family, relatives, we may not know their vaccine status, right? So you're getting that vaccine, you protect yourself, you protect that newborn as well. So there's no contraindication with breastfeeding.
Excellent. Thank you for that informative answer. All right, so next question. So there are a few questions on booster shots. So this one is, any thoughts on the impact of vaccine booster shots on fertility or pregnant women? Is there any research on women who have taken 3 shots and have become pregnant?
So booster shots, we're just knowing them as whether, we're going to be getting them or not. But right now, the booster shot or the third dose is reserved for people who have low immune or they're immunocompromised. Some countries have immunized all their population. For example, Israel, UK is thinking about it maybe end of the year. But if we have to go to that route, it would be the same philosophy of protecting everyone, and the fact that as we continue to get the vaccination, we're now getting more numbers from different registry, from all the side effects that have been reported through NACI or CDC. So this is going to continue to inform each and every one of us about the risk or side effects of COVID. But by and large, what I would say or advise is that if the booster needs to be given or the third shot, please get it, because we are still dealing with the fourth wave. Nobody knew this time last year that we will still be dealing with the fourth wave. If we don't get the fourth wave into control, then we get to the fifth, we get to the sixth, and this thing is cascading. The only way we can stop this and go back to our normal self is if all of us collectively get the vaccine and we get a herd immunity.
I could just add something. There is a community study looking at the response of vaccines among people from the Black community particularly. And this is run through a community COVID vaccine response project, is what it's called. We can put on, I think SCAGO has that information on the website. So if you have been vaccinated, you can, or have had COVID, you can have your immunity tested and followed over time, and you get those results. It's run through a SCIDS researcher. Thank you. So that would be on this COVID, on the SCAGO website for future.
Thank you so much, Dr. Kirby-Allen and Dr. Tunde-Byass. I have another question saying, Angie says, I have sickle thalassemia, which is very rare. I also get regular crises. How does this affect me getting the vaccine, given the components of the vaccine?
You could get the vaccine, Angie. The vaccine will protect you against getting COVID. If you are getting frequent crises from really frequent sickle cell crises, you should be talking with your primary sickle cell doctor to be placed on medication that can be discussed, medication that can reduce the frequency of crises. But you should still be vaccinated, because again, if you get sick with COVID, you could get very, very sick.
Thank you for that answer, Dr. Kirby-Allen. Next question, what impact does COVID-19, the disease, have on the female reproductive organs, the ovaries, uterus, and fallopian tubes?
So same question about reproductive health. The vaccine does not have effects, as we know now, on reproductive organs. However, if you get the infection, like I demonstrated with male, then you could have infertility in men from the infection, because COVID-19 infection affects the whole body. Similarly, it would be the same thing in a woman if you have overwhelming infection. But the vaccine itself per se, we have not had any report on effects on the ovaries, the tubes. What we have seen is just those transient changes in the period, which may need to be observed or investigated if it becomes an issue. So I still think that the vaccine is safe for women of reproductive age group if you have no other contraindication to it.
Perfect. Thank you so much. I do have another question from Fayez, who says, if the virus continues to mutate among unvaccinated communities, could the vaccine become less effective? And then I'm going to supplement that with another question in the same line of thought, where Israel is about 90% vaccinated, then how are we still expecting to achieve herd immunity once Canadians submit to taking the vaccine as well?
Can you repeat your second question, the supplemental one?
So the supplemental part was comparing how Israel is at 98% vaccination, and sorry, it keeps jumping. Then they're asking, how are we still expecting to achieve herd immunity once we Canadians submit to taking this vaccine? But the first part, I feel, is if the virus continues to mutate among unvaccinated communities, could it become less effective?
So absolutely. So if we don't achieve herd immunity, then the vaccine continues to replicate and mutate. And when we first started, we were hoping for a herd immunity in the 80s. And that was when we had alpha, beta, but now we have other strains that are coming from South Africa. I think it's C12. So as long as we don't get to herd immunity on time, the vaccine continues to replicate. What we need to understand is that science has not changed. What has changed is the virus. So it's race against time. Israel has reached herd immunity and they're already giving the third booster. I don't know how they've been able to do it. So I'm hoping as Canadians, we continue to encourage one another and see this as a priority for each and every one of us to be able to tap the next person on the shoulder, encourage them if they haven't, hear what they have to say, and hopefully we would all get to that point where we can get back to our normal self. I'm sure we all can't wait to get back out there, to visit without having to worry, to be able to go on our vacation. I think, we're close, but we want to be closer, the sooner the better.
If I could just add to that, is that even though the virus has been mutating in creating different strains, by still getting the current vaccine, you're still protected, and you're protected against death. Basically, you can still get infected, but not as sick and with ending with death. So it's still important to get it, even though you might be getting the Delta or the South African, whichever one it is, but it's still protecting you.
Good point, Dr. Kirby. Good points. Yeah.
Thank you for those answers. On those lines, though, so this is to supplement that. That's not a question. I think it would be helpful for the attendees to know, because there's been a lot of discussion around being vaccinated, and people are starting to be like, oh, once you're vaccinated, there should be no side effects, there should be no infection, there should be nothing should occur once you're vaccinated. And they're trying to use that as rationale not to be vaccinated, because some people still have breakthrough infections, some people still are hospitalized. So can you just give a brief overview of, of why the vaccinations are important, but at the same time, that it's protecting you from serious infection and death, but it's still possible to pass it through to those who are unvaccinated, and that's why it makes sense for everyone to get vaccinated. So even if you get it, you're preventing yourself from getting seriously infected.
You've just said it. Exactly right. You're preventing other people who cannot be vaccinated for some reason, very few. You're protecting your elderly relatives, your cousins who have cancer being treated with chemotherapy. You're protecting passing it on. You can from getting in decreased chance of you getting it yourself and so passing it on. And if you did get it yourself and it's a different strain, getting extremely sick. So there are people who've been vaccinated and have got COVID, but they're not ending up in hospital, in ICU. And most of the current patients, I heard this in Alberta for the last week, Alberta is bursting at the seams in their ICUs, and that's because they have a high number of unvaccinated patients attending in their ICU and going into their emergency, because the unvaccinated numbers are so high. So even in Ontario, the people who have ended up in ICU, we're told by the adult providers, are unvaccinated predominantly. So even though it's a new strain, it's still helping you to be safe. And we wouldn't really know. I don't know how many. I'm not fully vaccinated. I don't know how many people I've been in contact with who have COVID, and I haven't been infected with it. I would never know that. Not everybody's on the COVID app, but so it's possible that some of us who've been vaccinated have been in contact with patients. I see patients every day. I don't know. Some are unvaccinated, and most are thankfully vaccinated, those of age who can be. So it's still a good thing to be vaccinated for yourself and everybody else around you.
For sure. And I do have another question. Dr. Byas did very eloquently explain this earlier in her presentation, but a specific request for, in simple terms, how does the vaccine work and what is in the vaccine?
So for the vaccine which I presented, so you've got this, the mRNA, right? So which is protein, and that's like the coronavirus spike protein. So when it gets into your body sees it as, this is something that should not be there. So you mount an immune response, which is what your body should do. So once you mount an immune response, you develop these antibodies that sees this as foreign and then, attacks the vaccine. So those antibodies are already waiting in your system. They're ready. So when you contract COVID virus, your antibodies are already there. They recognize that the virus, the spike protein, and then they attack that spike protein in your body even before you get very, very sick. So this is the way that it works. So if you think about people who do not have a good immune response, they will not be able to mount those antibodies. And that's why those people become very sick. Or even if they get the vaccine, they may still not be fully protected. And that is why the people who are vaccinated, who are protected, can still protect those people who have low immune response or people who cannot mount as much of immune response as possible. So it's those fighter cells that are important that you have to have in your body that your vaccine has made you to produce, that is waiting for this infection and is ready to attack it if you come in contact with the virus. And that's the way to explain it.
Great, thank you for that great explanation. So this is more for you, Dr. Kirby-Allen. So this individual has asked, what is the recommended vaccine for a person with sickle cell, Pfizer, Moderna, or AstraZeneca, or does it matter?
It doesn't matter. And I think our patients have had all three types of vaccines. And if you have a concern about, I know with AstraZeneca, people were concerned about clots, and that has been a side effect, but you can speak with your physician and see if that's a particular concern, but just go ahead. Most patients are being given the mRNA vaccines, Pfizer and Moderna vaccines with sickle cell disease.
Great, thank you for the answer. So I was emailed just a few more questions, so I'll go through those. Once again for you, Dr. Kribbian. So this individual, let me just see the way they wrote this. So post-COVID period, they've taken hydroxyurea tabs, and they're wondering whether or not to continue to start or discontinue, or when to start. I'm not entirely sure if they're mean post-COVID vaccine or post-COVID infection. They just put post-COVID. But what are your thoughts around starting hydroxyurea?
There shouldn't be any interruption in hydroxyurea if you've been for around vaccination. You should continue. Continuing your hydroxyurea will keep you well. If you've been sick with COVID, some people have had to hold their hydroxyurea. You know, one of the things we look for as a side effect related to hydroxyurea is the drop in the white blood cell count. So on occasion, we've had patients in hospital who, because of COVID, drop their white cells. So in those patients, we would hold the hydroxyurea to allow their bone marrows to recover and increase their normal white cell numbers, and then restart the hydroxyurea. So I think that probably somebody may have been sick with COVID and been asked to hold the hydroxyurea. If you're sick with COVID, if you get COVID, but you're still being managed at home with runny nose or fever, etc., and you're still well, there's no reason, unless your blood counts have dropped, to hold the medication.
Excellent, thank you. This one's for you, Dr. Tunde-Byass. So for women with sickle cell disease, is there any particular contraception that is more safe?
So for people with sickle cell disease, we want to avoid things that would increase the blood clotting. So there are progesterone-only preparations which you can use. So things like IUD, intrauterine contraceptive device, is there, low maintenance. You can keep that in for 5 years. There are also progesterone-only pills, which you can take orally as well. And now we have implants that's back in the market. You can use those, and that you can use it for 3 years to 5 years. There are also progesterone shots, which can be used every 3 months. And so it's something like copper intrauterine device, which does not have any hormonal preparation around it. And of course, any of those contraception, you will still need to consider using your barrier method to reduce the risk of sexually transmitted disease, especially if you're not in a monogamous relationship.
Excellent, thank you for the answer. Another one, so this individual, she has sickle cell disease with twins, and she's pregnant with twins, and she's asking, should she go for a normal delivery or plan a cesarean section?
That's a good question. So sickle cell disease and pregnancy, there are risks. But in terms of mode of delivery, there should be no indication for cesarean section without obstetrical reasons. Okay, so someone with sickle cell disease with twins, if they meet the core criteria for having a vaginal delivery, you can have vaginal delivery for twins. Obviously, having a vaginal delivery has less risk compared to having operations. So if there's no other reasons, of course, you can have a normal delivery. However, if there are reasons why you cannot have a vaginal delivery, for example, if it's a placenta reason blocking the way, or the baby is in an abnormal position, which is not head first for the first twin, those would be indications for cesarean section. For sickle cell disease itself is not an indication for cesarean section.
Congrats to that person.
Yeah, so unless, of course, maternal choice. I forgot that.
Excellent, thank you. Okay, we've got a few more questions now in the Q&A, so Tolu will take care of those.
In the line of pregnancy again, should someone who gets the vaccine wait a few weeks or months to try and conceive?
It's a good question. When the vaccine was introduced, initially, we didn't know about the data on pregnant individuals because they were not included in the phase 1 and phase 2. So what we were advising at that time is that, take the vaccine and wait. But we know now that people who have taken the vaccine anytime during their pregnancy have had a normal and safe outcome. So you can get this vaccine anytime. That is the advice. So you don't need to wait.
Thank you. And then someone is also asking, have there been any reported incidents of adverse effects from the vaccine with sickle cell disease for a patient with sickle cell disease?
Not that I've heard of.
Okay. And Dr. Kirby, just going back to you, since we had a question about hydroxyurea earlier, we have a 33-year-old male with sickle cell disease who's taking hydroxyurea. Can it affect his chances of conceiving?
So that is a topic that has been a concern for men with sickle cell disease, whether hydroxyurea decreases spermatogenesis, the ability to produce sperm. If you look at sickle cell disease itself, is associated with lower sperm counts. And there are studies looking at hydroxyurea in men. Unfortunately, most of them are not before and after studies, where you do sperm counts before and then put them on hydroxyurea and do 6 months later or something. There was one study that was a before and after, and it didn't seem to affect the sperm count. There have been other studies looking at men with sickle cell disease on hydroxyurea, and their sperm counts have been shown to be less than other what are considered normal in men their age. But sickle cell itself, so it's hard to tease out, is it the hydroxyurea or is it sickle cell disease that causes the decrease in sperm counts? One thing that has come up more recently is that if you're an adult male and you're about to start hydroxyurea, one of the things you could do is store sperms before starting. Do a sperm collection and store for when you want to start your family, then you can those sperms can be used if you're having trouble conceiving afterwards. But it's a hard one to tease out just because sickle cell itself is associated with decreased sperm count. So hydroxyurea is thought also potentially to also reduce sperm count, but it's a hard one to tease out because of the underlying disease itself being affecting the sperm count.
Thank you for tackling that tough one.
Speak with your physician. Speak with your physician about the wish to start a family, and generally what we say is if you're on hydroxyurea and you want to start a family, go off the medication. Or actually, that's controversial. We used to say always go off for at least 3 months. I've heard more recently there's no need to do that because then you could go start getting into trouble with sickling, and that alone can reduce the sperm numbers. Having said that, in the big initial hydroxyurea study, which was published in the late 90s, we did have babies born to men and women who were on hydroxyurea breakthroughs because they were supposed to be using barrier methods, etc. But we did have, and in our practice, we do have young people on hydroxyurea who've got pregnant, both men and women. So I hope that answers it.
Again, thank you so much for tackling that complicated question. I do have another question for you with regards to sickle cell disease and thalassemia. So Patrina is asking, sickle cell disease, thalassemia, and trait. I would like to have a discussion on the effects and what to be aware of. If
Okay.
there's, yeah.
So a combination of sickle cell and thalassemia is sickle cell syndrome. I don't know that we have enough time to teach about sickle thalassemia. And if you're not already connected to you can, through the SCAGO website, we can connect you with either pediatric or adult program. I'm not sure how old you are, just so that we can be counseled properly and be managed properly if you're not currently in a sickle cell comprehensive care program. But the sickle cell complications are the same in SS and S beta thalassemia. That's significant. S beta thalassemia. S beta plus thalassemia, less clinically severe, but still some complications. It's a lot. That's the whole lecture. But I'm not brushing this off. But please contact me through the hospital, and I'll direct you if needed.
Thank you for that answer. Just want to let everyone know that we have less than 5 minutes left in this session. That I just launched the poll, so please give your answers of the poll that I just launched to give us some feedback, and we will try and just wrap up with 1 or 2 more questions, and I will bundle them up. So there's a few questions around menopause and sickle cell disease. So would you be able to tackle that, Dr. Kirby? And if there's any effects with the vaccine on menopausal women with sickle cell disease.
I think that's for Dr. Tunde.
That's okay. So just thinking about menopausal women, there's no reason not to be vaccinated. If you have menopause and you also have sickle cell disease, there's no contraindication to being vaccinated as well. So my answer to you will be to be vaccinated.
Excellent. Thank you. One last question. So this is a broader one. So this individual wants to know is how do we know there won't be any effects in the future? And I'm assuming they mean from the COVID-19 vaccine.
I think that's everybody's $1 million question, right? So in terms of what it is, whatever we're saying now is what we know, and also based on research on vaccines. I think those I's are dotted, some of the T's have been crossed in the basic understanding of how vaccines work during pandemic. So the broad thing right now, it's safety and being able to control the disease, which is the broadest thing. Obviously, we have the watchdogs like NACI and CDC collecting the side effects and adverse events from the vaccine. And that's the only way we're going to know and we're going to learn. There's nothing in the whole wide world that will be 100% safe. Even when you walk around the street, what is the chance that you'll be knocked down by lightning? The risk is 1 in a million, but it's not 0. What is the risk that you go under anesthetic and not wake up? In a country like ours, the risk is less than 1 million, but it's still not 0. But by and large, when we look at the risk ahead of us in terms of short and long-term effects of COVID-19, the benefits of taking this vaccine as of now outweighs those risks. We will continue to monitor whatever it's ongoing now and in the future to be able to prepare us for another pandemic. Hopefully, maybe there shouldn't be any, but whatever we have learned at this time, we can put it in place for the future. And that is where the post-COVID recovery and all those things are discussions that are being held as of now. So by and large, what should I do now? we should be all getting the vaccine and continue to monitor those side effects.
Great, and I think that's a beautiful note to end on. So I'd like to extend sincere gratitude and thanks to both you and Dr. Kirby-Allen for providing your insights and your time to address these concerns. Thank you, attendees, for participating. Hope this session has been enlightening and has answered your questions. And thank you for answering the polls as well. We will probably send a poll survey on Monday, and with all the information from the presentation, as well as the recorded session, so you can go through and see everything that's been answered. And if you guys have any questions or concerns after this, in that email as well, we'll provide contact details for both Dr. Tunde-Byass and her organizations, as well as SCOGO's resources, and you can reach out to us that way. So thank you so much again for joining us today, and have a wonderful rest of your day.
Thank you so much for having me, and nice to meet you, Dr. Allen, and thank you to the organizers and the host and the hostess.
Yes, thanks.
Everyone for joining, all of the participants. I hope this has been, I think it will be very useful. It has been useful. Thank you very much, and thanks for inviting me.
Excellent. Thank you. And also, we'd like to quickly thank Black Health Alliance and the Black Resilience Cluster for helping us put on this event and promoting it widely. We will probably be doing more sessions in the future, so please stay tuned. And yes, we hope that you've enjoyed yourselves. All right, thank you, everyone.
Thank you.
Take care.